Hey team, it's Dave Grovedahl, Chief here at Cumberland County EMS. One of the things that we are trying to do is change up our education just a little bit, do it in different formats, some of the things we had talked about at Con-Ed last time. So here is our kickoff presentation, pretty simple, talking a little bit about ET3 today. We have done a fantastic job, and those of you who have already had the opportunity to take a patient to Express Care, thank you. Those of you guys who have tried, but either the patient didn't agree to it or they didn't meet the qualifications, I appreciate that as well. We're going to continue this project. ET3 is something that we are very much invested in. It is going to transform EMS as an industry. So if you don't know what I'm talking about, you're not sure about the protocol, I want to go through a few things today that we've learned so far. So first, let's talk about the successes. We've had 9 patients, grand total, that we transported to Express Care. All 9 of those patients were treated and released from Express Care. The average age of patient that we've transported was 64, and the average amount of time that they spent at Express Care from the time they arrived to the time they discharged was 152 minutes. So just under 2 hours, or excuse me, just over 2 hours. So not bad, and we're going to continue to work on this project. Of those 9 patients, actually 2 of them were actually true Medicare. The very first 2 patients that we transported actually were not Medicare patients at all, but that's part of the growing process, and we're okay with that. But I wanted to go over a couple of things today, review the protocol, just be a reminder that it is an option to go to Express Care, and then some changes with the Express Care. So first and foremost, Health Pavilion North, the hospital system has decided that it is now going to be a COVID-19 immunization center. So they actually have shut down the Express Care portion. And so now our only option for Express Care is to go to Highsmith-Rainey. So please make a mental note of that. The only Express Care that we're going to be transporting to is Highsmith-Rainey. The second piece is that the patients that we have taken to the Express Cares have all been good patients. They've all been treated and released. None of those patients wound up having to be transported over to the emergency department. So the first thing I wanted to go over was what is the actual requirements, or what are the indications to take somebody to Express Care. The first one is if they're going to need extensive imaging, that is not a patient that's going to be able to go to Express Care. They can do x-rays, and they are pretty much limited to that. They can do a CT. The problem with doing a CT at Express Care is not the same thing as an emergency department. So they do have to get pre-authorizations, where in the emergency department they do not. And pre-authorizations at the Express Care can take upwards of 3 or 4 hours. And you can imagine where we're trying to get these patients in and out in 2 or 3 hours or less. Trying to get those pre-approvals just really doesn't work. So if you have a patient who has abdominal pain, it looks like it could be appendicitis or diverticulitis or something else, that patient unfortunately will have to go to the emergency department for the foreseeable future. Patients that we believe should be able to go to Express Care, so minor motor vehicle collisions. I've got some neck strain, maybe some lower back strain. It doesn't appear that they're going to have any significant injuries. Those are patients that we can offer to go. Patients who have common cold or upper respiratory symptoms, those are good patients. We're getting ready to come into flu season, so if you suspect the patient may have the flu, that would be an option. The ones that cannot are going to be your RSVs. So if you have an infant that potentially has RSV and is having respiratory distress, that's probably not going to be a good candidate to go to the Express Care. If they've got mild shortness of breath with a cough, once again, it looks more along the lines of an upper respiratory or a head congestion, then that's okay. But if it looks like they've got pneumonia or are septic, then those are patients that would not. Anything with an eye, ear, or nose complaint. We actually had a patient the other day that had a headache, and it turned out that they had an ear blockage. So once they were able to clean their ears, the patient's headache went away. That was an excellent patient that went to Express Care. That patient was actually in and out in 60 minutes. Some of the other things, some dehydration if they've had an animal bite, only a dog or a cat. So if you have somebody who's been bitten by an elephant or has been bitten by some other weird exotic zebra cobra from Raleigh, probably not a patient that needs to go to the urgent care. But minor cat and dog bites, those are okay to take there. Some minor burns, so first degree burns, things that are not circumferential in dangerous areas, sunburns and those kinds of things are going to be okay. Patients with lower back pain or ground level falls where they have not had any type of loss of consciousness, they're not intoxicated, they don't appear to have any orthopedic injuries, those would be okay to go as well. And then some of the things that we typically see, the mild allergic reactions, dental pains or medication refills, or if a patient has a medical question that for some reason they called EMS and want to be transported, those are great patients for urgent care. You can find this list, and I definitely encourage you to refer back to your protocol. This is UP24. On the back side is the list of low acuity complaints that can go. Once again, kind of think in your head about the testing that's going to be done. If it's mild lab testing, if it's x-rays, that should be fine. If they're going to need extensive workups, that's probably going to be a patient for the emergency department. So I want to tell you something interesting about myself. I have a daughter who goes to college and is a softball player at Lees McRae University in Banner Elk. She is a softball catcher. So interesting little tidbit about me. If you ever want to come in and talk, we can talk softball. Come springtime, we can talk about anything related to softball, because I am 100% hardcore fast pitch softball. The other thing that we have noticed is that it's difficult to decipher Medicare and Medicare Advantage. So Medicare is going to be a card that looks a lot like this. You'll notice the red, white, and blue across the top. It's going to say Medicare Health Insurance. This is a Medicare patient, and ET3 is a CMS or a Medicare program. We're hoping to expand this into the public sector with the typical private insurances that we carry, but we're still working through that process. But notice the card that we have right here. This is what the Medicare card looks like. You're going to want to take a look at this and view this. It's not a big deal if you take a Medicare Advantage patient. We are still able to bill the patient or bill the private insurance because it is a contract that private insurance company has with Medicare. We can still bill them, but really the ET3 program for right now is intended for the Medicare patient. So if you do have the opportunity to view the Medicare card, this is what we're looking for. A lot of times your patients aren't going to know if they're Medicare or Medicare Advantage. There's really minor differences, so it is a little bit confusing. This is an example of a Medicare Advantage card. This one right here is an Arkansas Medicare card. One thing that you will notice is that the Medicare Advantage words are going to be somewhere on this card. If it's a Humana or a United, their name will show up as well, so one of the private industries, and then it'll say Medicare Advantage probably somewhere on the card. Like I said, if you encounter somebody who's a Medicare Advantage, they're willing to go to the Express Care, that's fine. We can still take them if they're Medicare to those. If they are true private insurance, we're not quite ready to take those patients to Express Care. We're working on some of those contracts. We hope to have that soon. So really, to summarize up, keep doing what you're doing. You guys are doing a great job. We've taken 9 patients to urgent care. We would love to see that number continue to increase. So when you are out there and you're getting some of those low acuity type calls, think about whether or not this patient is appropriate for the Express Care. I know at night they're closed at a certain time, and it makes it a little bit more difficult for the night crews to take patients to the urgent care. Hopefully we'll be able to expand the hours of the urgent care in the future as we prove that this model really does work and we start taking more and more patients to their urgent care. So think about it. It's an option. Refer back to that protocol, UP24, low acuity condition, alternate care options. We really hope you like this education. We're going to do a lot more in this format, as well as doing a lot of other really cool stuff coming down the line. I think you're going to be real excited with some of the ideas that Pam has and is getting ready to implement. So you guys have a great day. Be safe out there. Talk to you soon.